What is the blast phase in chronic myeloid leukemia, CML? Imagine a disease that starts slowly and then suddenly becomes much more aggressive. That's what happens in the blast phase of chronic myeloid leukemia. This phase is also called blast crisis because it resembles an acute leukemia, which is a fast-moving and serious type of blood cancer. In the early stages of chronic myeloid leukemia, or CML, most blood cells are mature and healthy, and symptoms are often mild or even absent. But as the disease progresses, it can enter an accelerated phase with more abnormal cells. When it reaches the blast phase, the number of immature white blood cells, called blast cells, skyrockets. These blast cells make up at least 20 to 30% of the cells in the blood or bone marrow. These immature cells do not work properly and can crowd out normal blood cells. This causes symptoms like fever, fatigue, weight loss, and an enlarged spleen. The disease can also spread beyond the blood and bone marrow to other parts of the body, forming tumors called myeloid sarcomas. Because of the high number of blast cells and their aggressive behavior, the disease progresses very quickly at this stage. The blast phase usually follows earlier phases of CML, where the disease is more controlled and symptoms are milder. Sometimes, however, it can happen right at diagnosis, which is called de novo blast crisis. The outlook for patients in this phase is generally poorer than in earlier stages. Treatment options include targeted therapies, chemotherapy, and stem cell transplants, but even with these, the prognosis remains challenging. The key point is that the blast phase marks a critical turning point in CML, where the disease becomes much more severe and resembles acute leukemia. It requires urgent and intensive medical management to try to control the disease and improve quality of life. Always remember, if you or someone you know is dealing with CML, consulting a healthcare professional is essential for personalized care and the latest treatment options.